Even if your kidney is compensating, but it decrease in arterial pressure, the urine formation will be decreased because less apparent arterial pressure in your kidney, so filtration rate will be decreased and formation of what your kidney will not function properly, so further intake further retaining of salt and water will be decreased. Therefore filtration begins and continue indefinitely unless major therapeutic procedures are used to prevent this outcome. Furthermore, because the heart is already pumping at its maximum capacity, this excess fluid no longer has a beneficial effect on the circulation. Instead, the fluid retention increases the workload on already damaged heart, and severe edema develops throughout the body, which can be very detrimental and can lead to death. It is necessary that your body compensate and your kidney retain the fluid, but your heart is weakening continuously. Your heart is going weak. Your heart muscles blood supply is weak. Is no any blood supply. So so further increase in blood volume will have no effect on your heart, and it increases the load on your heart more than it can bear. So what will happen, you will goes to your heart will goes to what to death. Detrimental effect of excessive hydration and severe cardiac failure. Its adverse effect on your in cardiac failure by your kidney. So let's study. Okay, its detrimental effect of excess. In contrast to the beneficial effect of moderate fluid retention in cardiac failure, in severe cardiac failure, extreme excess fluid can have serious physiological consequences. These consequences include increasing the workload on the damaged heart, overstretching of which further weaken the heart, filtration of fluid into the lungs, causing pulmonary edema, and consequent deoxygenation of the blood. And what is this? And what? And consequent deoxygenation of the blood, development of extensive edema in most part of the body. These determinants of excessive fluid are discussed in latest section of this. These determine what's the effects: increasing workload on the damaged heart, overstretching of the heart, pressure of fluid into the lungs because of edema, and pulmonary edema because your heart is not contracted properly, so your pulmonary veins, your blood will backflow to the pulmonary veins from the left ventricle, and it will cause pulmonary edema and filtration of blood into the lungs. So this is cause during extends to edema and because your superior vein your blood will flow back to your superior and inferior vena cava, and it will cause systematic edema and body edema. So we will be discussing this in detail. Okay, so not go we'll have to finish this chapter because it's very long, and explaining each and every point is very difficult for me, but there are many YouTube channels that are explaining, but some are missing some points and some are missing some points. So for a student to learn each and everything, it's very difficult. So I'm trying to explain each and every point because uh, each and every point understanding is very necessary. Like if you have partial knowledge and not other, so it's very difficult for us. So that's why I'm trying to, like, each student want that they understand everything very well. So if there is, like, but I will just go. Okay, let it go. Okay, so recovery of the myocardial infarction. So if you like, this is all the explanation in the graph. Like I have said in the graph, these are their graph explanation. Like if your heart recover, so that I have said in this graph, like what this partially recover heart and recover heart. So if your heart is recovered after many days by compensation, so what happened? After a heart becomes suddenly damaged as a result of myocardial, the natural reparative process of the body began to help restore normal cardiac function, and new collateral blood supply began to penetrate the peripheral portion of the infarct area of the heart, often causing much of the heart muscle in the fringe area to become functional again. Also, the undamaged portion of the heart musculature hypertrophies of setting much of the cardiac damage. So this is recovery. What's the recovery process of your body? Your heart from collateral blood circulation, it collateral blood between different artery. If there is like in left coronary artery there is any thrombus, so the branch is from the coronary artery. It from collateral blood circulation with right coronary artery or other branch, so that blood supply maintained to the same area. And along with that, for compensation it also cause what, your muscular, your heart hypertrophy, because it's adaptation to this changes, like high force of contraction when going on your heart, so it will must hypertrophy because high stretching occurring on your heart. So okay, so the degree of recovery, which depend on the type of cardiac damage, vary from no recovery to almost complete. After acute myocardial, the heart ordinarily recovers rapidly during the first few days and weeks, and acute spinal stab recovery in 7-5. Although mild degree of additional recovery can continue for months, the recovery from cardiac failure, it will be continue for months. It will not stop. Like acute recovery occur after what, during the first few days, but its final stage of recovery, it goes on, it is continue recovery occurring because it is not that simple. Okay, cardiac output curve after partial recovery. This is all the this is all the fun I have explained. Okay, is all the, but I will just show punctual partial recover hard week also after acute migraine. By this time, the product has been retained about in the tendency to administration has been marked. Therefore, as I said, I have I have explained this very well. Okay, as a result, the stage of circulation is now changed from cardiac because of the cardiac output has returned to normal outflow upload as return to normal and no further fluctuation occur, except that the retention upload that has already occurred continue to maintain moderate excess fluid. Okay, therefore, except high right arterial pressure represented by point in this figure, the person now has essentially normal cardiovascular dynamics as long as he or she remain at rest. Okay, if the heart recovers to a significant extent and adequate fluid volume has been retained, the sympathetic stimulation gradually abates toward normal for the following, just as with sympathetic stimulation, therefore, as the heart recovers even slightly, the fast first rate chords can failure resulting from sympathetic stimulation in the acute stage of cardiac failure gradually disappear. Like if you have acute cardiac failure, so you will have a high pulse rate, cold skin, and failure. You will be paler, but gradually with time, in recovery, like in acute, this is because of acute myocardial, which if your cardiac failure is chronic, so recovery is not possible. But if you have acute cardiac failure, so this is the so you will be recovered. Like if Allah want to give life, so you will be recovered. Okay, an acute stage, because and when collateral circulation develop and when hypertrophy, so you will be recovered in acute stage. But if there is chronic cardiac failure, so recovery is impossible, then you will go to the death. Okay, summary of the changes that occur after acute cardiac failure compensated heart failure. If like there are two cardiac failure. One is compensatory and another is non-compensatory. Compensatory is when your body adapt and when your body act and compensate according to the need of your body. And uncompensated is when your body fails to adapt to that situation, that reduce cardiac output, so then you will go to death. But if your body the ability to compensate, then you will recover soon. To summarize the event described in the first few sections, describe the dynamics of evolution after acute moderate heart rate. You can divide the state into the instantaneous impact of the cardiac damage, compensation by sympathetic nervous system, which occur mainly within the first 30 seconds to 1 minute, and chronic compensation resulting from partial heart recovery and renal retention. All these things are shown graphically by the black line and the I have the problem in Guyton is it has many repetition, like it repeat and repeat. But it's necessary to read each and every point as I said. Chronic compensation resulting from is that the proposition of this line shows the normal set up circulation for the state of few years. I have said this before. But before sympathetic repression have a point with their rise in coronary cardiac of toward normal caused by sympathetic point C or no more. Okay, it's not especially in figure the maximum pumping ability of the partly recovered heart is depicted by a player to level of the leg is still depressed to less than one half normal. This demonstrated the increase in right arterial pressure can maintain the cardiac output at a normal level despite continued weakness of the heart. Thus, many people, especially older people, have normal resting cardiac output but may lead to moderate elevated right artery because of various degree of compensated heart failure. These persons may not know that they have cardiac damage because the damage often has occurred at a later time and a compensation has occurred concurrently with the progressive stage of the. When a person is in a stage of compensated heart failure, any attempt to perform heavy exercise usually causes immediate return of symptoms of the acute failure because the heart is not able to increase its pumping capacity to the level required for exercise. Therefore, it is said that the cardiac reserve is reduced in compensated heart failure. This concept of cardiac reserve is discussed more fully later. So, your cardiac reserve is basically your compensation. Your body, your cardiac reserve is what the cardiac reserve is reduced in compensated. Like if any force occur on your heart, so normally if you have normal, okay, if you have normal heart, okay, and you exercise, so your cardiac reserve what it increases, and it increases your cardiac output increases, your heart rate increases. But in cardiac failure patients, the cardiac reserve decreases. Then if you like lift a weight or go upstairs, so what will happen? You will feel pain and you will have problem of angina. So your cardiac reserve is decreased, your cardiac output cannot increase further because you have already high arterial pressure and high pressure, so it's not possible. Okay, so dynamics of non-compensated heart failure. Non-compensated mean non-compensated or decompensated if the heart becomes severely damaged. So, if the heart becomes severely damaged, no amount of either by sympathetic nerve reflex or by fluid detention can make the excessive weak in heart pump in a normal cardiac. As a consequence, the cardiac output cannot rise enough to make the kidney exceed normal quantity of fluid. Therefore, fluid continues to be retained. The person develop more and more edema, and this state of even eventually lead to death. This condition is called decompensated. That's a major cause of decompensation is failure of the heart to pump estrogen to make the kidney excrete the necessary. So if your heart goes to that level, that it make the kidney don't it the kidney cannot excrete on that pressure the necessary amount of fluids every day. So it is chronic heart failure. It is decompensated heart failure, and it will you will go to and it will lead to death of that patient because what this is because of what this is because the body is compensating by retaining more and more blood. So what occur? So if it is edema occur because your heart is going weak and weak, but your body is retaining fluid and fluid. So it will what